people say, like, you're doing all this great work, and really, that's how scared I am. I'm going to lose my daughters.
And I have kids at the same age right now.
Mm-hmm. Yeah. Lane would be 21.
Welcome back to Airdrie Inside. Here we are at Nose Creek Park one more time. This beautiful venue on a beautiful summer day. I am with Michelle Bates. Michelle, welcome to the show.
Thank you very much for having me.
Now, Michelle, just before we got started, I asked you what your title was, and there's no way I'm going to do it justice by trying to repeat what you told me. So can you tell me what your title is with the Airdrie Health Foundation?
Yeah, so I guess I would be a co-founder.
Okay.
We are the story behind the foundation, and I've had different positions. Right now, I'm the vice chair and acting executive director.
See, and that's better than I was going to do trying to repeat that. So tell me a little bit about yourself. Let's get to know you a little bit before we hop right into the subject that we're talking about.
Sure. So I'm old. No, I grew up in Airdrie. My family and we moved here in 1981 when I was 5. And met my husband at the time, and we both grew up here. We knew we wanted to live here and grow our family, and now here with we have our 3 kids, Lane, Emily, and Alyssa, and as we will talk, Lane has passed away.
Right.
But I am a pharmacy technician out at the Peter Lougheed for 27 years now, and then working at the Airdrie Health Foundation on my rest of my time.
Wow, it sounds like a really complete schedule and very focused on healthcare. Now, prior to getting on camera, you told me one other thing that I want to highlight because it's a constant theme. I went through a run where I didn't have any Mustangs on. So you are a George Mack grad.
I am a George Mack grad.
Excellent. So the right school on the west side. I like to hear that.
That's right. There was only 2 high schools at that time. And the year I graduated was the first year that we had graduates again at George McDougall, because we were a junior high.
It turned from a junior high to a high school again. Yeah, that's a little bit of Airdrie history back then.
A long time ago.
Back when we actually had a Tower Lane mall.
We had a mall, and when I moved here, we didn't have the traffic lights. We just had a few 3-way or 4-way stops, and nothing was built over on the other side of the train tracks, and
Well, I moved here 16 years ago now, and I've only ever been on the other side of the train tracks for where I live. So it's crazy to see the growth that we've gone through. And that's part of the topic that we're talking about, is how that growth has affected our healthcare delivery and how healthcare is administered here in Airdrie. So obviously, working at the Peter Lougheed, this is a career choice for you in a way to be involved with healthcare, but there's personal reasons behind the Airdrie Health Foundation. So why don't you tell me about that? Tell me the story.
Yeah. So becoming a pharmacy technician, I say, is the career I chose, and the Airdrie Health Foundation is the journey that kind of chose us through circumstances and stuff. So it's all about healthcare, and working at the Peter Lougheed has helped in a lot of ways, because when you come up with people in the healthcare industry and government that say, oh no, just go to Calgary, I can say, but why? I was on the units today, and there's 4 people in the hallways, and things like that. So it was beneficial in a lot of ways.
I had an experience at the Peter Lougheed. I was eating in the food court, and I accidentally ate a butter tart that was mislabeled, and it had almonds all the way through it.
Oh, no.
And I went into anaphylactic shock, and it took about an hour and a half of work by not only just one doctor, but a whole team of doctors to keep me here and alive today. I don't think I would have made it if that was in Airdrie. It's such a fast-moving situation, and it's something I think about often, is how I felt in that moment, that helplessness.
Yeah. Minutes matter. And I guess that's where our journey starts and stuff. I don't know. Do you want me to tell a little bit about that?
As much as you're comfortable. Like, I know it's a personal story, and I know it does involve some tragedy, and I don't want to focus just on that.
No.
I want to focus on all the good that's come from it.
We've done amazing, and but it does come from a story where minutes matter and stuff. So October of 2009, our son, it was height of H1N1, and he wasn't feeling well. He didn't have a fever. He just wasn't feeling well, and Mama had a bit of an instinct something wasn't right, and I just kept trying to figure it out. And through my healthcare journey with kids and stuff, I've taken the kids to the doctors before, and you get questions from the doctors or the staff saying, like, we can tell that they're fine, and so you start second guessing yourself. And I wouldn't say I second guessed myself, but I was trying to look more into it and stuff. And that night I was working at the hospital, and I came home with height of H1N1. I know the wait times are really, really long, and I just had this feeling I just want a doctor to see him. And so I got home and we discussed, well, he's sound asleep, fine. How was his day? What did he do? And we discussed, where are we going to go, and what should we do? Urgent care at the time was closed at 10 p.m. So, this is after 11 p.m. So that's out of the question. And there's 12 to 16 hour waits at the children's and the PLC and stuff. So he's fine as long as he's sleeping. Once they wake up, I will take him to a doctor's. And like many families, we waited. You don't know the danger. You don't know how sick you are. People just don't know how sick they are sometimes. And he didn't make the night. He woke up later on, and things deteriorated really, really quick. Ambulance was really quick. At that time, Airdrie had fire EMS combined, and wait times were amazing at that time. And they really, really did great work, even though things didn't, he didn't pull through. And then a year later, we were in a situation again where I put my daughters to bed, and my youngest at that time. So Lane, when he passed, was 5, and then I had a 3-year-old and a 1-year-old.
Wow.
And so Alyssa was about 2, and this was in December, and there was a massive snowstorm, and the snowstorm actually closed highways around Calgary for 5 days, east of Calgary and stuff. So it was a big one. And I heard a cry, and I knew something wasn't right. And it was 10 to 10, and I knew urgent care would be closed. And so we did the best that we could. I started to think it might have been an ear infection. So called the pharmacies, what can we do? They gave us some medicine, but said, sometimes there's a reaction. And so I'm not waiting. I'm not waiting for a reaction. I'm not waiting for anything else. So we headed to Didsbury in this massive snowstorm, and we left our other daughter with family. And the whole time I thought, we could die on this trip. And then Emily's alone, and she's already not the little girl she was born because of losing her brother and stuff. And so then I just made the call to our MLA, who was Lane's soccer coach the summer before, and just had a conversation. Why don't we have a hospital? Why don't we have 24-hour care? That led, let's have another meeting with the mayor. So we had another meeting and another meeting and another meeting. And pretty soon we had this group, and we were advocating. And, my intent was we need a hospital, do the work, get the hospital. Why don't we have that? Why don't we have urgent care open? And I very quickly saw, our great local people here really advocating with me and stuff like that. But I could see how politics played into things. And I remember sitting there thinking, you guys get paid to behave like this and argue. And eventually I'd say, my son died. There's people behind this. And then I found things shifted. And I very soon figured, if I wasn't doing this, then, and just left it to others, things could go forward. But there was so much fighting, much, you have everything you need and you need nothing. And then people would reach out to me with stories about what happened to their loved ones. And so I had all these stories that I could say, but this happened and this happened and this is reality. Right. And the stories really, really matter. And that kept moving things. And it's a lot of emotion and energy. But Lane is more than just his passing. He was an incredible little boy, and he wanted to save everyone. He did. He was only 5, and he wanted to be a fireman. He wore his fireman outfit for 2.5 years because he was going to save everybody. The stories I get from preschool about how there's a lot of children with disabilities in his class, and he would open all their juice boxes and their snacks, and times teachers would go and start opening something, and the child would actually smack the teacher's hand and say, "No, Lane helps me." And he just wanted to save people. He walked in when I was watching a program on 9/11, and the plane hit, and I know Lane's heart. He's the most empathetic little boy, and he just knew things beyond his years. And so I waited. I knew the impact of the plane was coming, and then I looked at him, and he had the biggest crocodile tears. He was so upset. He was crying, and he was angry, and he hit the couch, and he's like, "I'm going to be an army man, so no one does that again." And he struggled for the next little while between being an army man and being a fireman. And to see a child 4 and 5 years old, like, I don't know what I'm going to do. I don't know what I'm going to do. How do I save people? Right. And before his passing, unbeknownst to me at the time, he had settled some things. One of them was he was an Oilers. I'm an Oilers fan, and he's a Flames fan. Okay. And so out of nowhere, he comes up to me. He's like, "Mom, I got it. And I'm like, "What? Like, what could be possibly that you got?" And he's like, "When the Edmonton Oilers play, I am going to cheer with you. And when the Calgary Flames play, you can cheer with me. And it's okay for us to cheer for our teams when they play against each other." And
sounds like he had compromise in his heart there.
He just needed people to work together and to get along. And it's okay to do things differently. And when you're not doing it differently, you're doing it together. And he came to me and another time, and he's like talking about being a fireman. And I just stopped, and I'm like, "Wait a second, a fireman? You're talking about being a fireman?" He's like, "Yep." And I said, "You decided?" He goes, "Mom, I'm just a fireman." And so when I do all this work and we do the advocating and knowing Lane, this is what he would do. We always talked about, before he passed, about how he would just be helping people. And our logo is his hand. He liked to play doctor, and he would doctor people. So I think we're doing the right thing by honoring him by saving people, and we know we have.
Wow.
Yeah.
I took a different path to parenthood. I waited until I was much, 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 much older, and I became a father when I was 40, and I have kids at the same age right now.
Mm-hmm. Yeah. Lane would be 21. He would have been 21. But
it's funny because the podcast that we posted today while we're recording this was Jacob Ardown from On the Bench, humorous podcast. Mm-hmm. He had me crying and laughing, not crying out of emotion, but
yeah. Lane would have you crying out of funny too if he was here. But
kids are amazing, eh?
Yeah. I've never seen a kid with a heart like his, and
So you go from such a personal tragedy to what we see today. Yeah. Talk to me about that journey.
Yeah. So we started as a grassroots group, politicians, we had the mayor and some counselors on board. We had the medical director at the time. We had community members. Right. And we started advocating, started making a lot of noise, and people feel uncomfortable in Alberta Health Services and the government. At one point, they were going to lay off, the government and AHS was going to lay off the nurse practitioners at the urgent cares. And we were able to say, no, that's not okay. And we're not going to just stand by that. And they rescinded those layoffs. And they did an urgent care report showing that urgent care really needs those nurse practitioners. Right. Here in Airdrie, we didn't have enough doctors covering all the shifts at the time. So nurse practitioners were working there without doctors sometimes.
And that's still a problem from time to time where I read about it being closed because of lack of staff.
Well, we've only had that a couple times, and that was over COVID. Yeah. So being so close to Calgary, right? That's the answer. Go to Calgary. And as we see with ambulances, they pull support from the around Calgary to go into Calgary. And we also had that during COVID. They were pulling doctors from Airdrie to go to Calgary. Right. And one specific time, the doctor was sick himself with COVID. So that did unfortunately shut it down for a little bit of time. And we've been good since. So hopefully it doesn't close again.
Well, hopefully we never go through COVID again. That would be
hopefully life does not go through that again. But yeah, we've done such great things. We went from this advocating group and making noise, and in this report it showed Airdrie really needed a new facility. I'm still waiting for that new facility, but we have done a lot of good. So there's been 2 renovations. One's being completed right now, $8.4 million from the government in there. And then in 2014, we became a registered charity. So we can take donations and we can give tax receipts. We're having our 12th gala this year, October 18th, if anyone wants to come. It's Halloween themed. It's going to be great. And we've been able to raise funds to purchase and support programs and equipment that otherwise would not be purchased. And
for Airdrie.
Well, for our facilities.
Yeah, our region here. Yeah.
The one thing I think that's really important for people to know, because you hear a lot of backlash about our urgent care, and we support more than the urgent care. We support that facility. Urgent care is one of those departments, but urgent care is not for life-threatening emergencies, although the number of life-threatening emergencies, so those would be C-task 1s and 2s, those numbers are in the thousands now, where they were
in the thousands in Airdrie.
Yeah, throughout the year. When we started, they weren't that high. And so our urgent care is treated as an emergency department by our community. And the foundation has been able to help bring in equipment, crash carts. We've had do not go and have a baby at urgent care. But we have had babies born at urgent care. And so we have bassinets and all the equiment if a baby needs to be born there. But again, please don't go there.
Make a better plan is what you're saying?
It's not a birthing center, but baby has its own mind sometimes, right? And but we've been able to do pediatric equipment, bigger equipment. We've supported Pregnancy and Beyond. Wow. That's a program for young moms for the first year of babies' lives. So we actually pay for the RN to work in that program. Otherwise, that program would shut down, and Airdrie would not have that with the public health nurse. So a lot of the health foundations won't support a person, but we do because it's needed. So Airdrie is a little bit different than the bigger foundations, but a lot of the smaller foundations like us, we have to do those things, otherwise we don't get it.
Right.
So we're hoping that urgent care can be an emergency department and staff proper, and that gives more equipment and things like that.
When you mentioned that there's other foundations out there, the larger ones, have they helped with your setup and given you guidance? Like, we're such a unique situation because we have such a large population center, so close to another large population center. When people compare it to Drumheller or Didsbury, it's not an accurate comparison because it's a very unique situation. So is there any foundations or any municipalities that are going through something similar that we could copy and take some best practices from? Yeah.
So when we started, there's actually, I think, 69 health foundations in Alberta.
Wow.
Yeah, that support their most of them are hospitals. We support urgent care, but a lot of the other foundations were able to help us. So we reached out with High River quite a bit, and the foundation out in Okotoks that covers their urgent care, and the Black Diamond Hospital.
Okay.
And then behind us, one of the newer foundations is Cochrane. So I was able to work with Cochrane to kind of tell them what we did, introduce them to the right AHS people, help connect them and stuff. So their foundation was able to start a lot easier and quicker than ours, and without all, it was quite, my word slipped my mind now, but it was quite contentious when we started.
Yeah.
And Cochrane is now about the same population that we were when we started. So they're right behind us. And in our I know in the conversations I have, when we talk about Airdrie, I always say, what about Cochrane? What about Chestermere? There's these communities around us that they're coming right up behind us. So what you're doing for us, you have to start planning for them as well. So our logo is together we can make a difference. And I like, honestly, when I meet with health ministers or AHS and stuff, when I talk about Airdrie, it's just not the healthcare. We don't have hospice. We don't have a women's shelter. We don't have a teen shelter. There's so many things Airdrie doesn't have. And so I take that opportunity to say this is Airdrie in a nutshell. And not only don't we have this healthcare, but we don't have all of these other resources. And I think all of those things funnel back to healthcare.
Yeah, I was going to say, healthcare isn't just hospitals, urgent care, and doctors. It's, I've always been a pretty big proponent of athletics, and as a high school football coach, I do believe that having those facilities help keep people out of danger and not in urgent care on Fridays and that kind of thing. So I do think that we need to have a bit of a better solution for some of those infrastructure needs here. Where do you see, this is a really interesting time in the world when it comes to funding and where we are in the province and where we are as a globe. Where do you see things going? Is it getting better? Is it getting worse? Are we looking at the end of the wilderness, or are we still wandering through?
I have to tell you, as a healthcare worker working at the hospital, and then the work with the foundation, being in Airdrie, I'm nervous and I'm worried. We have our healthcare system being dismantled. Will it be better? I can't tell you that. Do I see a lot of gaps? Do I see a lot of people falling through the cracks? Absolutely. And so I think until these pillars all get worked out and stuff like that, then we'll have a better idea of what's going on. But to me, it's just another thing to postpone what's happening here in Airdrie. We do have a new urgent care that's been announced, but again, I think we're just pulling resources. We're splitting resources. There's differences in the two urgent cares. So I look at that, where if an ambulance is called and an ambulance is told to go to one of the urgent cares, which one are they going to? I know for myself, if I had to go to urgent care, which one am I going to go to? One might have better diagnostics, but the other one does not have a lab. I'm now being told the new one will have a lab in it, but that's new, and I haven't seen all that work yet. We've been told that the staff would take the draws of blood and such, and it would be sent over to our current lab here in Airdrie. But then my questions are: does the lab have capacity to take on blood work and samples from another urgent care? And then the lab closes at 6 p.m. and it's not open on the weekends. So if you need, blood samples taken, tests done in the middle of the night, which one do you go to? The one with the lab or the one without the lab?
And you might not even know that until you get diagnosed or you get seen by a doctor. You might be at the wrong facility.
100%.
Yeah, it's
100%. So there's so many questions that make me nervous. I truly believe we just need one new facility and not split our resources, our staff. It's already hard to staff sometimes out here. So now you're splitting the staffing, and there's money to plan it. That doesn't mean it's going to be built. So when's it going to be built, right? That puts it off. And then who's going to run it? It hasn't been announced on who's actually going to run the urgent care. So there's all these questions. So you have a government that says we're moving forward, but no, not really.
You don't see the steps that show that you're moving forward.
Show me the date that it opens and what's in there and when is the shovel going in the ground. Then I know what's happening. But saying that, this is our plan. It's a plan. And
it's by no means the same or as important, but I was involved with the field turf project. And you'd always hear, well, we have a plan.
Yeah.
But until that shovel went in the ground, I didn't believe it.
Right.
And in fact, even after the shovel was in the ground, I was still pinching myself a little bit.
Yeah.
So
Yeah.
you're never quite sure where it's going to go. I'm going to play devil's advocate here.
Yeah.
I think I know the answer to this, and I have my own opinions, but I hear this a lot when people say Airdrie needs a hospital.
Yeah.
Calgary's getting one on the north side. Shouldn't that take care of our region?
Well,
And I don't believe that, but I just want to give you a chance to tackle what I think is probably the biggest criticism that gets leveled at people who want a hospital.
Yeah. So my question would be, when is Calgary getting that North Hospital? Again, it's a plan. It's been discussed. For us, when I started working on this, back in 2011, I had my first meeting in December of 2010, and we started going in 2011. And when we first started speaking with AHS, that's the carrot they dangled in front of us. Well, there's land in where Livingston is now for a hospital. So you'll be really close to that. And so that's the carrot that's been dangled since 2011 in front of me. And there's still no plan. There's $3 million to plan that was allocated a few years ago, and they haven't spent that money. So there's money for a plan that's not being planned. So again, Airdrie needs a hospital because we can't rely on Calgary. By the time a hospital would be built in Airdrie, that's going to be 8 to 10 years out. So 8 to 10 years from now. So when I say we need a hospital, it's not going to be open tomorrow if they say Airdrie gets a hospital. You're looking 8 to 10 years out. And how many people are going to be living in and around Airdrie? I've
heard around, in that span, about 130,000 residents in our city.
And the way Airdrie's growing, it's probably more. But then it's not just Airdrie. So we support Bicycur and Ear-Canna. From Ear-Canna to the Peter Lougheed, 72 kilometers.
Wow.
So it's not just Airdrie, it's the residents northeast, west of us as well. We need to support them. They need a place to go. We're looking 8 to 10 years out. Why wouldn't we? Nothing's been planned for Calgary. The other thing that concerns me is everything, go to Calgary. But the resources don't then follow back here in Airdrie. So two good examples. One of my pharmacists, she works with the geriatric patients at the PLC. And for years and years and years, she says, we have a patient here in the Peter Lougheed that lives in Calgary. They're discharged and they go home and they have follow-up with that geriatric physician and their entire team. So a nurse and all the other resources, physio, nutrition, dietitian, whatever in their office. If you come to Airdrie, you don't have access to that doctor and her team. You get to see that doctor once a month and just her with no follow-up from her team. So even though Calgary's close and you can go to Calgary, nothing follows back out here.
Yeah, and you don't get that support structure built around it, right?
No. And so when I spoke with that doctor, she said the patients that she has in Airdrie, by the time she sees them, they're usually critical.
Wow.
Because now if you do see her in Calgary, it's evidence-based. People like, well, I have to take time off work. And then there's the traffic. And if you're elderly or you don't drive, how do you get there? There's no direct transit to any medical facility in Calgary. You can get downtown Calgary, you can get to the mall, you can get to a C train station, but if you actually had to go see a cardiologist or something on the south end of Calgary, it's going to take you a few hours to get there just for that appointment. If you have to do Uber or something, what if you don't have the money for that? Seniors don't like to travel in the winter and things like that, or even on a sunny day down there. Another example I have is a friend, her sister had passed away of cancer. And in that time, she lived in Calgary and she had her children with her. And came a time where they wanted her to come to Airdrie with her kids. So her sister, her family could care for her. But the funding for for that palliative care didn't come to Airdrie. Wow. So her kids came here to live with her aunt and aunt's family, but her sister had to remain in Calgary alone.
Wow.
Without her kids. So why doesn't that money funnel to Airdrie? So when I say Airdrie needs a hospital, Airdrie needs a healthcare, it's because, yes, Calgary's close. You can get treatment in Calgary, but you can't get anything, not much here in Airdrie.
Yeah.
And why should you be separated from your family at the end of life? Because that money doesn't follow you into palliative care.
Even if it's not palliative care, if it's like I was recovering from a shoulder surgery that I had, and I did feel the same sort of isolation from my surgeon. I needed. It's so funny because I grew up as a relatively healthy adult, and this is the first time in my life where I'm dealing with. It wasn't permanent, but somewhat of a disability. I wasn't allowed to drive for 8 weeks, and she's telling me to come for follow-ups. I'm like,
how do you get there?
Well, this is a problem.
Someone has to take time off work,
Now,
right?
luckily, I have resources and I have
not
family
everyone
and I have
does.
structure. But if I didn't, that would be an impossible task. I just wouldn't go for the follow-ups.
Right. And then how would that be, right?
Yeah.
Your health isn't increasing, it's decreasing because you're missing things. And depending what you miss in your healthcare journey could be detrimental, right? And so that's my biggest thing. Like, we have to make sure that the healthcare comes to Airdrie, not just to the border. If it comes to the border, will those resources come here? Yeah. You know, we have 1,200 babies being born to Airdrie moms a year. It's in Calgary. Right. And we have great public health here, so you can do your follow-ups here and stuff. And like, again, we say the foundation supports that Pregnancy and Beyond program. But again, these are things, if you lived in Calgary, if you lived in Edmonton, lived in those, it's funny to me to say rural and urban. I think we're urban. But we are considered rural. So
we were rural when I got here. We're now urban.
Well, when I started working on this, when I moved here, there was maybe 8,000 residents in Airdrie. When Lane passed away, we were at 34,000 and now we're over 90,000. And we haven't had, so at the health center, there's public health with, you know, the postpartum visits and the vaccinations, but there's other clinics, the wound care, a little bit of palliative care, and stuff like asthma and things like that. But there's no new money to any of those clinics. We have 2 mental health facilities that are in different buildings because they can't, there's no spot big enough for them. I just met with them, and they have programs that they need to offer our residents, but there's no place to hold those programs. So we're looking at alternatives now. How do we get a space where they can offer these programs? There's so many things Airdrie's lacking, you know, never mind a hospital, but it's all these other things. You know, we don't have a diabetes clinic in Airdrie. 90,000 people, no diabetes clinic. We don't have dialysis. Thank goodness for Volunteer Airdrie and their Drive Happiness program, which we've helped support. Volunteers from our community drive patients to their dialysis appointments. A few years ago, when we were getting all the facts and numbers about the dialysis, half of the patients in Airdrie that have dialysis could not make their appointments 3 times a week on their own for dialysis. And if it wasn't for Drive Happiness, they would not get to dialysis. No dialysis, you die.
You know, it's a saying I've always had is don't short the long dollar. And it seems like what you're telling me is what's going on. If we don't get patients dialysis, they become more expensive later on on the system. So spending the money now for $1 is better than spending it for $1,000 in 3 or 4 years. Right? Like, it's, you know, I'm trying to interview you and put less of my feelings out there, but it's hard not to get angry when you hear some of the things you're saying to me.
Well, and as I've heard, like, this isn't information that I just knew.
No, definitely not.
This is because of my journey, right? And I have to ask the questions, and people come and tell me their stories, and then you look more into it and you ask the questions. But I know, like, I don't know a lot about cancer. I haven't, fortunately, been touched by a lot of cancer. But that doesn't mean it's not important.
No.
It just means it hasn't touched me. You know, people don't know about the grief work if they haven't lost someone that they love, right? I don't know much about dialysis because I don't need dialysis or diabetes, but I've learned all of that stuff. And the general public, you don't know what you don't know until you need it. And so I ask that people out there, when, you know, they hear me speak, like, I don't have all the answers, but I've done a lot of talking. I've asked a lot of questions. I have a lot of information, and it shouldn't be discounted. You know, like, when you don't know something, don't just be like, oh, that's not right. Like if someone's saying something, then you should maybe say, hey, maybe that is important, and realize,
be curious at least.
Yeah, be curious and don't say no, because I hear a lot of people, we don't need a hospital. I'm like, but don't we? Like, why don't we? It's been proven that if you're sick and you're in a hospital, so say you have a senior in Airdrie and they're in the Peter Lougheed or another Calgary hospital and stuff like that, their friends are seniors as well, likely.
Yeah.
And they don't drive. They don't come and visit you in the hospital, especially if it's winter. Their families are working, their kids, grandkids, they have sports and stuff, so they come and visit. But it's been proven for any person that if you're in a hospital for a long period of time, even probably just a few days, if you have your support people, your loved ones there visiting you,
heal faster.
You heal so much faster. It's a real thing that you get depression being in a hospital in that setting and stuff. So if we had a center here, I'm not saying we need a full trauma hospital. Like, by all means, we don't.
We're not getting the South Campus here on Main Street.
No, we don't need that, but we do need a facility here where you can have overnight beds, so you don't have to go to Calgary, right? You can be here for a day or two, close to your family. You can have surgery in Calgary and be transferred back here where your family can see you, and you heal faster. You're home. I had a family member out in Black Diamond. They ended up having a heart attack. They stayed in Black Diamond at the hospital. They went into the foothills, had their procedure, back out. Their kids would be able to visit, ride their bike and visit in the hospital before they went to school and come and check on mom after school.
That's great.
Right? So just being close to your family. I had a family member that was in the hospital for a couple weeks. They had little kids. And so now the husband's working, has 3 kids at home, but needs to be there for their wife.
Right.
How do you do that when you're in another city? I mean, it's...
Well, we went, this is so relatable because everybody gets touched by healthcare, no matter if you live long enough, you get touched by it. Right? My wife and I, like I said, we have resources. We have people in the city. My parents live here. We have a lot of connection to the community. When both our twins came down, I have 2.5-year-old twins, Linky and Rihanna, and they came down with our RSV. And but they came down at separate times. So I took off to take Lincoln to the hospital because he needed it. And then, 2 hours later, while I'm sitting there in emergency, Kim texts me, my wife, saying, Rihanna needs to go too. And we had a 4-year-old as well.
What do you do?
And now we're like, okay, we've got to make some phone calls. We gotta do what we can. And it was a very similar experience when Lincoln and Rihanna were born. I should have a podcast dedicated to Kim's story because so much that you're saying was wrapped up in that. She was sent home too early. She had preeclampsia. She had to go back to the hospital. Of course, the hospital that they sent her to was the foothills, very far away. Our son was at the PLC. Mom was at Foothills, son was at PLC, and they're telling me that our daughter can't stay with the son, even though they're twins, born 20 minutes from each other. And then I find out at the very end of all of this that there was supposed to be a social worker to help us with this whole thing. And because of where we were located and because of all the moving around, it fell through the cracks. And in my life, I've never been more stressed than that week. And I have the resources. I have what I need. I couldn't imagine being poor or not speaking the language or not having your family there. What do you do?
Right. And that's what we see here, right? And those are all my worries. Those are the stories I hear. And, even, we've experienced some of that ourselves. What do you do? Where do you go? You make the right questions. Sometimes you're questioned when you get to the healthcare facility and stuff. But trust yourself, trust your intuition, do what you have to do. And hopefully one day it'll be here in Airdrie that we don't have to leave. We paid for an extra blood work testing to be done at the health center. The footprint can't grow. It can change inside, but it can't grow. So there's one test, and I won't know the name of it and stuff like that, but I know that there was a lot of ambulance trips, transfer trips, just for this one blood test. So they need to rule something out, and it's very serious. So you have to take the ambulance in. Now you're in Calgary. How do you get home? Because the ambulance doesn't bring you home.
Yeah, it's not a two-way Uber.
No, and sometimes, you're in the right place. You needed that test. It proves you need this extra help. You need to be in the hospital. Great, you're right where you need to be. But for those people that majority of the time, it came back negative and they were fine. They don't need that extra help and stuff like that. Now they have to come back home. And we've just wasted an ambulance drive. So we were able to pay. They asked us for funding for that. We were able to get the testing done here, and we were able to cut out that one trip. So those are the type of things that we do with the Airdrie Health Foundation. We just try to keep people in Airdrie as much as possible. You're going to need the big hospital at some point. But you had said, earlier that I don't know if we would have been okay going to urgent care. And so my goal is that if you show up at urgent care for whatever it is, you have a chance.
Yeah.
Lane didn't have a chance. It was closed. I had nowhere to take him. We waited till morning. But you need a chance. And I feel that we've all done really great work, and that if you showed up at urgent care, they have what you need to have a chance. You can't stay if you're having a heart attack and stuff. You need that hospital in Calgary, but if you show up there, I received a call the one day, and it was mom. I'd known her for years. Her daughters played soccer with my daughter and stuff, and she said, I need to tell you, her husband is at the hospital. He had heartburn, and he wasn't feeling well because of this heartburn. And they live outside of Airdrie, rural. And they were in Airdrie, and they were doing some shopping, and he said, I'm just going to go sit in the truck. And so she said, fine. She finished, get back, and she goes, I don't know why, but I said, urgent care's just down the road. And he said, okay.
Yeah,
and
let's pop in.
It's heartburn, right? So she said, I was really surprised. He said, okay, but we got there. It was the perfect time. Like, nobody was there. We walked in, sat down. They took him straight back, and he coded. He had a massive heart attack, and the doctors there didn't even think he would make it. And so when the doctors saw him later come through the doors and say, here I am, you have a chance going to urgent care. You do. And my friend had called and said, like, the crash cart that they used has the Airdrie Health Foundation sign on it. And she said, because your son died, my husband lived. And we've heard stories about people living. And if you're there at 10 o'clock and that door's not locking, it's because a little boy passed away. And you have a community that fought to have it open. And so those are the changes that we've seen, and we've been able to support so many people that won't even ever know it, and that's fine. Don't need the recognition, don't need the pat on the back or whatever. But if it wasn't for a very supportive community, I couldn't do the work that I'm doing. And
we're almost out of time, but I want to ask one last question. You seem, and I don't mean this in any slight, but you seem like a very ordinary person doing a very extraordinary thing. Mm-hmm. Tell me how that transformation happens, and how people can get involved to do good things like this. Yeah.
For me, people say, like, you're doing all this great work, and really, that's how scared I am. I'm going to lose my daughters. I needed a place that if I need to, I couldn't take Lane somewhere. And like, by all means, he was not sick. Like, if I would have called, 811 and said, what do I do? They would have said, just bring him in. But I really felt someone needed to see him. Yeah. And he didn't have a fever. His color was fine and stuff, but I just had this feeling. And you need someone there to see you when you need to be seen, not when they think they need to see you, when you need to be seen. And that's always been my thing. And then a year later, when I had to leave in a snowstorm for my daughter, and when COVID hit, my eldest daughter, she was having trouble breathing. She had COVID, and she had a bit of trouble breathing. We had seen the doctor in the morning, and he gave some steroids and stuff like that. But then it was getting evening again. It's always in the evening. She said she was doing okay. And then it was around 11. I'm going to bed, and she's like, but Mom, I'm having trouble breathing, and I'm not going to bed now. And I packed her up, and we went to urgent care, which was open. Right. And the equipment that they're doing all her vitals and stuff have the Airdrie Health Foundation sign on it. And I said, this is why I'm doing the work. If my daughters need something, they have it. I'm that terrified that something will happen to my kids. And I've heard a lot of stories over the years and stuff like that. No one wants to feel like me. No one wants to be this mom. And so that's why I do the work I do. I fall back to the frontline staff often to say, this is how I feel, but is this true? Is this what you're seeing? Because I can come up with anything, right? But I always fall back on the experts, and we work so closely with the frontline staff. They know what we need. And so we work with the frontline staff to get Airdrie what they need. You come in and you need something, and they come back and say, hey, we have eye injuries, and we have to send them out into the community to an eye doctor. Well, we bought, the big instruments and stuff to see the back of the eyes, or they come in with people with their fingers crushed with their rings. If you want to get your ring off, we bought a ring cutter. You have a broken arm and you have to get the cast. You couldn't get your cast cut off in Airdrie. You'd have to go to Calgary to get your cast cut off. So we got a cast cutter. So all these small things, all these big things, that comes from the amazing frontline staff that we have saying, this is what we need. This is what we see with our patients. And so, if you want to become involved, I
was just going to ask, for anybody who's listening, this is one of the best causes I've seen in a long time, and I've heard about in a long time. And that's saying something, because I spent some time with Hope Air and some other really great organizations. Where can people go to find more information, and how can people support you? Yeah, go to our website, airdriehealthfoundation.com. And they were working on, we're getting a new website through Switchback Creative. We got a grant through them, and I believe it's up and running today. They were working on it. Hopefully it's posted. You can make donations there. All the money we raise stays in Airdrie, or we haven't had it where we're working outside of Airdrie yet, but there might be that time where Airdrie residents benefit for something in another community. And of course we would support that, but all the money that we raise stays for Airdrie residents. And our hope is that when you have a healthcare issue, whatever it might be, palliative care, wound change on your leg or whatever, you have the resources here in Airdrie. And we have our events coming up, our gala, Light Up the Night Gala. It's our 12th annual. This year it's a Halloween theme, spooky soiree. It's just a really good night, good entertainment, fundraising, sit-down dinner. Donations is what drive us and make things work. And you can always volunteer for us when we have a few events throughout the year or whatever. But healthcare affects every single person. It's not a one-off. Michelle, thank you so much for spending some time with me. Thanks. I'm glad we can keep working and keep people here. Excellent. Help everybody. And thank you for spending some time with us here on Airdrie Inside. We're going to be back with more great shows in a minute.